Manu,
Yes, sir.
yeah, you can start your presentation.
Okay, sir.
And there is a time limit, 7 minutes for your presentation and next 3 minutes for a discussion. So we will, put the buzzer when you will reach 5 minutes and the final buzzer on 7 minutes. So in
Okay, sir.
conclude. All the best.
Okay, sir. Thank you, sir. Good afternoon, everyone. My name is Manvi Shukla, and I'm research scholar in Department of Psychology, Gorakhpur University. And I'm pursuing my PhD under supervision of Professor Sushma Pandey, ma'am.
Please,
And the topic,
please,
and the topic,
please
yes, sir.
put your slide on presentation view.
Yes, sir. I'm sharing my screen.
Uh,
Are you able to see my slide?
full screen. You can do slide share.
Okay, sir. One second.
ठीक है ठीक. You can start.
Okay, sir. So, the topic for my today's presentation is the relationship between child abuse and learning disability among adolescents. Child abuse is a wrongful treatment of a child. It may be in the form of physical, emotional, or sexual abuse. This form of abuse may also be recognized as the exploitation of a child as well as the failure to properly care for the child. There are certain types of different types of learning disability, such as physical abuse. Different types of child abuse, such as physical abuse, psychological abuse, and sexual abuse, and different types of neglect, such as physical neglect, emotional neglect, and educational neglect. Child abuse and neglect can affect all domains of development of children, such as physical, psychological, emotional, behavioral, and social development, and all of these are interrelated. A sizable number of studies evidence that abused children display distorted cognitive functioning. A strong association have been made between child abuse and learning disability. Abuse and neglect in the early year of life can seriously affect the development capacities of children, especially in the critical areas of speech and language. Talking about learning disability is a general term that refers to a group of disorder manifested by significant difficulties in listening, thinking, speaking, reading, writing, spelling, or arithmetic skills. Most often, they fall into three broader categories, that is dyslexia, reading disability, dysgraphia, writing disability, and dyscalculia. The consequences of LD are serious and damaging on overall development of children. Learning disability can affect all domains of development, social, emotional, cognitive, behavioral, as well as overall development. A sizable number of studies evidence that the learning disability disabled children display distorted cognitive and behavioral functioning. It has been suggested that there is a relationship between child abuse and learning disability. Perhaps child abuse causes learning disability, perhaps learning disability places a child at a particular risk for being abused. Perhaps both are true. People with learning disability have an increased vulnerability to abuse because of dependence on other people for personal care, an imbalance of power between the carer and the person being cared for, difficulties in communicating, lack of sexual knowledge and assertiveness, and guilt and shame of being disabled. Present study was conducted with following specific objectives and hypotheses. In this study was carried out with the following objectives. The objective of the study was to study relationship between child abuse and learning disability and their various domains, to find out the predicting roles of different domains of child abuse and age in various types of learning disability. On the basis of above objectives, it was hypothesized that there would be a positive relationship between different types of learning disability and various domains of child abuse. Various domains of child abuse and age would be found strong predictor of learning disability and its various types. In this study, to assess the relationship between domains of child abuse and different types of learning disability, correlation have been computed. A total sample of 60 students age range 10 to 18 years studying in different schools of Gorakhpur was selected for the present study. These are the measures used in data collection: personal data sheet, diagnostic test for learning disability, child abuse checklist, specific learning disability comprehensive diagnostic battery, and learning disability battery. After the completion of data collection procedure, the data analysis was done using correlation and regression analysis. These are the results. Correlation were computed between child abuse and learning disability. It is apparent from table that different forms of child abuse are positively correlated with various types of learning disability. To determine the role of various domains of child abuse and age, stepwise multiple regression analysis was done. These are the results of regression analysis. Prediction of reading disability. It is clear from the graph that emotional neglect was found strong predictor of reading disability, which contribute maximum 52.2% variance, followed by psychological neglect contributed 17.3% variance, and physical neglect contributed 13.5% of variance in criterion variable. Prediction of writing disability. Sexual abuse was found strongest predictor of writing disability, which contributed maximum 37.6% variance, followed by age, which contributed 7.8% variance in criterion variable. Prediction of mathematical disability. Physical abuse was found strongest predictor of mathematical disability, which contributed 25.5% of variance, followed by sexual abuse, which predicted 9.8% of variance, and age, which contributed 5.8% of variance in criterion variable. A prediction of overall learning disability, as we can see in graph, educational neglect found to be the strongest predictor of overall learning disability, that is 65.1% of variance, followed by physical abuse, which contributes 18.8%, sexual abuse 4.2%, physical neglect 2.8%, age 2.4%, and emotional neglect, which contribute 2.8% variance in criterion variables. The major findings of this studies are results depicted that there is a strong positive relationship between different types of and various types of learning disability. Further, the results suggest that with increasing level of abuse in adolescents, the level of learning disability also increases. This confirms the role of different types of abuse in exhibition of various domains of LD and LD as a whole. Overview of multiple regression analysis result evince the positive contribution role of various domains of child abuse and neglect in various types of learning disability and overall learning disability. Implication of this study. Result of this investigation might deliver a base of for certain preventive actions to be carried out. In addition, directing such kind of study will be of worth for from a psychosocial and developmental perspective. Further, study is quite essential in contributing to the knowledge base concerning child abuse, learning disability, and its correlates. There are some limitations of present study, which are as follows: that the sample was small in size, the age range of participants was limited, some of other factors which affect child abuse and learning disability should be explored. Hence, this should be investigated in future researches. Thank you.
Thank you. Is there any questions?
Any question from the presenter?
Yes, sir. My presentation is left.
Please wait, Sakshi. We have a. Is there any question for Mansi?
From the house. From Mansi. Manvi.
Yeah, Manu.
आप लोग अपनी opinion. Manvi, one thing. आपने ये अब्यूज के बारे में स्टडी किया, तो सारे कई तो कैसे जैसे होंगे जिसमें मल्टीपल टाइप ऑफ अब्यूज एक ही पेशेंट में भी हो रहा होगा, है ना?
जी सर।
ये क्या, ये तो इसमें नहीं दिखा कि ये आपने दिखाया कि ये अब्यूज, दिस अब्यूज इज रिलेटेड टू दिस वेरिएबल। तो क्या
यस सर।
ऐसे कोई पेरेंट है और अब्यूज कर रहा है अगर, तो यूजुअली फैमिली में ही अब्यूज की बात लग रही है ना?
यस सर, यस सर।
तो अगर पेरेंट को ये अब्यूज कर रहा तो हो सकता है कि इमोशनल अब्यूज भी हो, नेग्लेक्ट भी हो, ठीक है, किसी तरह फिजिकल अब्यूज भी साथ साथ चल रहा हो, तो कंपाउंडिंग इफेक्ट को उसने में आपने देखा है क्या इसका?
नहीं सर, मैंने ओवरऑल सर मैंने देखा है, पर यहाँ पे रिपोर्ट नहीं किया सर। एक्चुअली मैंने रिग्रेशन में ओवरऑल नहीं डाला, क्योंकि कई बार होता है कि ओवरऑल जो रिजल्ट्स होते हैं वो इंडिविजुअल डायमेंशन वाइज रिजल्ट को सप्रेस कर देते हैं सर।
तो आपने डायमेंशंस पे ज्यादा जोर दिया है, जो मैंने तो एक तरह से कहें कि मल्टीपल टाइप ऑफ अब्यूज हो रहा है, उसका इम्पैक्ट आपने नहीं देखा है इसमें।
यस सर।
आप रिजेक्ट आपने नहीं किया है।
जी सर।
यूजुअली हम लोग तो ये देखते हैं कि ये एक तरह का अब्यूज नहीं होता है, अब्यूज हो रहा है तो कई तरह का अब्यूज है, फिजिकल अब्यूज भी है,
यस सर।
इमोशनल अब्यूज भी है, सब साथ साथ चलता है। तो एकदम सेपरेटिंग वन अब्यूज फ्रॉम अदर इज अ वेरी डिफिकल्ट टास्क है।
Yes. Then question I prefer to separate that.
चलिए अच्छा है। और किसी का कोई सवाल वगैरह? ठीक, थैंक यू।
थैंक यू सर।
ठीक है मानवी, थैंक यू।
थैंक यू।
You can mute yourself. Sakshi, can you start your presentation?
Okay, sir. I'll share my screen.
You can start. You can share your screen and start presenting.
Yes, sir. I'm sharing my. Sir, is my screen visible to you?
Yes, you can start your presentation.
So first of all, I'm really sorry. I'm actually traveling right now, so I'll be presenting from my phone only. And
No problem. You can start.
okay, sir. Okay. Good afternoon, everyone. My name is Sakshi Malik. I'm the research scholar at Manav Rashna International Institute of Research Studies in Faridabad. My supervisor is Professor Priyanka Srivastava, and I will be presenting on the technological advancement in the treatment of autism spectrum disorders in India, a rapid review. This is the roadmap which I'll be following: the introduction, research questions, methodology, result, discussion, findings, and the references. Uh, Today in India, there are many studies which have reported varying prevalence rates. A community-based survey which was conducted in Chandigarh assessed 8,451 children aged between 1.5 years to 10 years have identified 19 cases of autism spectrum disorders, resulting in the prevalence rate of approximately 2.25% per 1,000 children. Another report cited data from the Indian Journal of Pediatrics indicating that around 1.12% of children aged between 2 years to 9 years are affected by autism, equating to 1 in every 68 children. The prevalence rate of the autism spectrum disorder is being increasing day by day in India. The purpose of this rapid review is to answer two questions. How has the literature review evolved in the technology-based detection of autism spectrum disorder? The second research question, which is which biobehavioral markers are being used in the detection of autism spectrum disorders in children? There are many technologies which are being evolved nowadays. For example, my purpose for the technological advancements is the focus on the digital behavioral pattern that can be captured from the computer assisted technologies or the wearable sensors or the smartphones that can be easily assessed. For example, there are many technologies that are being used to assess the facial features of the children who are being suffering from autism spectrum disorder. They assess their facial features, the facial landmarks, the eye contact, how long the poor children is making an eye contact, the questionnaires, and also they monitor their behavioral pattern, digital behavioral pattern when they are working on, when they're using smartphones or they're using computers or they are using any other smartphone apps nowadays. For this, I have used the methodology, the Prisma extension for rapid review guidelines to ensure the methodological transparency and rigor. I have taken three databases, which is the Google Scholars, PubMed, and Scopus, and I have included in my paper the 25 studies after extraction of the studies as per the Prisma guidelines. The keywords which I have used are technological advancement, autism spectrum disorders, using Boolean operators, and or to refine the results. And further, I have made the research on basis of the applications, like for example, the Canvas DX. It is a commercial app which is being developed in the USA, and has been commercially used in the US population in the clinical settings and the hospitals. It uses user structured video analysis. It analyzes their facial features, their behavioral patterns, and they also provide children the questionnaires in their application, which can be filled by the caregivers and the clinicians to provide a diagnostic indications. And the other three apps, which are like Guess What, Start, Sense Talk. These are the research apps. They are not they are not being used in the commercial settings till now, as it has some limitations. So the limitations need to be addressed first, so that it can be go to the clinicians, so that they can use in further diagnostic purposes in the clinical settings. Guess What is a research app which is for 1.5 years to 12 years children. It uses structured videos of parent-child interaction in arcade-style game, applying face tracking and emotion recognition techniques. The Start it measures social, sensory, and motor skills through games and activities alongside parents' questionnaires, which are being filled by the parents of the children who are suffering from autism spectrum disorder. Sense Talk is for also 1.4 years children to 12 years children. It uses movie designed to elicit autism related attention and motor behavior while capturing responses via the front camera. Now we come across the discussion. I have drafted the discussion in the 4 domains. Firstly, we'll be talking about the current methods for the detection of autism spectrum disorder, which are being currently used. For the development screening nowadays, we only go for the pediatrics and the healthcare professional often use recommended screening tools to know child developmental stages during health checkup. These tools help identify early signs of autism spectrum disorders and the other developmental delays. Also, a comprehensive evaluation by multi-specialists, including the pediatric psychologist and speech language pathologist, is typically conducted to diagnose autism spectrum disorder. This evaluation may involve observing the child behavior, conducting developmental assessments, and obtaining information from parents about the child's developmental history. In the clinical setting, the determination of autism spectrum disorder is based on the criteria as per the DSM-5 and the ICD-11, which are being currently developed. And in the medical imaging, advanced neuroimaging techniques are being developed, such as MRI, fMRI machines. They are being used to examine the brain structures and identify any abnormalities with autism spectrum disorder. However, brain imaging is typically used to rule out other medical conditions rather than to diagnose the autism spectrum disorder. Current challenges which are being faced by the professionals, mental health care professionals in the detection of autism spectrum disorders are the diagnostic delays. Because many children with autism spectrum disorder experiences significant delay in receiving formal diagnosis, which delay their access to early intervention and service and support. Also, there is very limited access to the services in many parts of the world, especially in the low resource settings in India. This is particularly challenging in rural and under-reserved area where healthcare resources are very behind. They are very far behind. Cultural beliefs and linguistic diversity can influence how autism spectrum disorder is perceived and diagnosed. Lack of culturally sensitive assessment tools and diagnostic criteria may contribute to underdiagnosis or misdiagnosis of ASD in certain population. And there is the important thing, which is the stigma surrounding mental health and developmental disorder. It actually delays the early intervention services and support. It can be related to any other mental health disorder, not only autism spectrum disorder, but every mental disorder may prevent individual and families from seeking help or disclosing symptoms. So I think very greater awareness and these stigmatization efforts are needed to encourage early detection and intervention. Comorbidities and complexity. Autism spectrum disorder often props with medical or psychiatric conditions such as intellectual disability, epilepsy, or anxiety disorder. Identifying and addressing these comorbidities. Hanji,
please
sir.
please summarize. You are exceeding your time limit. Please summarize.
I'll be concluding by saying that there are many digital behavioral markers which are being used nowadays. Especially in India, it has not been very many researches are lacking where the autism spectrum disorder, because I haven't found any researches which are being done in India, especially in terms of autism spectrum disorder, because many researches for the depression has been used. Bipolar disorders, they're being used by the NIMHANS, AIMS in the collaboration with the LAMP platform with the Harvard University. So for the autism spectrum, outside India, they are being using eye tracking, gaze analysis, facial and emotion recognition, speech and language analysis, gesture and motor movement tracking with the help of AI-powered devices. Major findings, which will say the video analysis. The apps uses video recordings to tag facial expression, gaze, and movement patterns, and analyze structured play interaction to assess social engagement and emotional responses. And also, some apps incorporate validated surveys for parents and practitioners to complete digital assessment. These are the references of the studies which are used for making the presentation. Thank you so much.
कोई क्वेश्चन अगर है बता दो। Thanks for your very lightning presentation. Though you exceeded much of the time. Thank you.
Thank you, Sakshi. You may leave.
Thank you so much, sir.
Yeah, thank you.
Okay,